Since we last spoke, we've added some additional capacity. So you're aware that the county has had an initiative to create alternative care sites for people who are both symptomatic or need to be isolated, and another group of vulnerable people, seniors, people with compromising health conditions. So those are the two types of sites we've developed. We now have 4 county sites in total. We have a leased facility in the East Valley for vulnerable individuals, a hotel that is being rented in the East Valley also for people who are vulnerable, and a new hotel that was added since we last spoke. It was added May 12th in downtown Phoenix, also for vulnerable individuals, 36 people. And after about a week, that hotel was filled. So in total, we have the capacity for 137 rooms that were not in existence prior to the COVID crisis. Almost 100 individuals are now in those rooms. We have some capacity still, which is important, to add more vulnerable people and also people who may be symptomatic or need some medical treatment. So we're prepared for somewhat of an increase if that occurs. We know that the county is not alone in providing these alternatives. Cities, nonprofit providers are also making arrangements for people in their care or agencies they fund. An update on the tent relocation. So 3 county parking lots were identified, were mapped out with the proper spacing distance according to the CDC. Individuals voluntarily moved into these with their tents. Some did not have tents and were provided tents. Most were provided cots. The county provided water, toilets, hand washing stations, security, and staff. But what I want to talk about this afternoon is the fact that the staff are there to engage people. So these are no longer just people living on the street. There are people in county lots. We have their names, we know their histories, and we're talking with them regularly. Human service campus staff are engaging people to see what is the next step, what needs to be done to help them move on to their path towards a permanent housing solution. So some of the people that were in the parking lots and the tents, what we call safe outdoor space, also have been identified and been placed into shelter or got medical care that were identified by staff working in the tent area. Just yesterday I was there and circled the city, an amazing healthcare for the homeless provider, had their mobile van in the lots. There they were doing all kinds of checking in terms of people's medical conditions. They were taking temperatures, they were doing wound treatment, they were doing blood pressure, and of course addressing the symptoms of COVID with people. So we hope that there's going to be able to be progress overall as a result of this. We know that some of the homeless shelters have had to reduce the capacity, the number of people they can take in, because to allow for social distancing that's required to keep people safe. So there's less capacity now in homeless shelters throughout the valley. And we've also moved some people out into these alternate care facilities I was mentioning. So we want to use our available resources now to make housing placements for people we put in these other facilities. We also know that after the crisis is over, shelters are going to be able to fill back up. So many of the people who are on the street should be able to move into shelter facilities. So what we want to do is respond what's necessary to the crisis, but use the assets and resources we've developed and the connections we're making with the homeless people to be able to help with permanent solutions for them.